Good afternoon and welcome to our 18th Franczek webinar since the onset of the COVID-19 pandemic. This week's panel is an Ask Anything format where we will address your most pressing questions as Illinois schools prepare to reopen in the face of unprecedented challenges. We are delighted you are with us today for the next hour, and thank you for joining us and for submitting your questions during the registration process and during the webinar. My name is Ares Dalianis, and I'll be moderating today's webinar, filling in for Jackie Wont, the firm's legendary webinar moderator. Jackie is taking the week off as she is doing Title IX training today. The Title IX compliance date for the new rules is August 14th. Please let us know if we can assist you with your training needs. Today I'm joined by our regular webinar panelists, my talented and wise partners, Shelli Anderson, Nicki Bazer.
Hi everyone.
Fattore Crumley.
Good afternoon.
And Jennifer Smith.
Hello.
Our focus today will be the COVID-19 issues impacting school in the fall. We are dedicating the full hour to answering your questions, so please share any questions using the Q&A function at the bottom of your screen. To get started, we received many questions via the registration process. We may not get to all of them, but we will begin with those questions. And I want to highlight before we begin that next week we'll be hosting our regular webinar at noon on Thursday. We will continue the Ask Anything format for questions we haven't gotten to today and for any changes that occur during this fluid period over the next week. And as always, if you find yourself looking for more information or if we're not able to get to your question, please reach out to any one of us for information. If you missed any of our webinars, you can find them archived on the website at franczek.com, where you can also find more information about webinars, alerts, blog posts, and podcasts. Now, with that, let's jump in. Shelli, I want to start with you. So we received the following question. Any update on what to do if a staff or student shows symptoms or tests positive for COVID-19?
Thanks, Sarah. So I think I want to start first with the second part of that question is what to do if a student or staff member tests positive for COVID-19. And as those of you who have looked into our protocols that we've developed with respect to exclusion and isolation from school know that if you have someone who tests positive who's symptomatic, so you had a teacher or staff member, teacher or student who has actually had symptoms, they obviously need to be excluded from school as soon as you find out that they've tested positive. And they have to stay out for 10 days following the onset of symptoms. If they're asymptomatic, it's 10 days following the positive test result, and then 72 hours that they are fever-free without the aid of any fever-reducing medication. Now that has recently been changed by the CDC to be 24 hours fever-free. We are waiting for IDPH to adopt that guidance, and we believe that they likely will. So that's a little bit of a change now that we have from the science perspective as to how long someone needs to stay out. Or the alternative is that the person who had tested positive has 2 negative tests at least 24 hours apart, then that person can then return to school. The symptomatic question in terms of someone has not tested positive but has symptoms, if you have someone in the school building who has symptoms, you need to move them immediately to the isolation area you have. And if it's a student, contact a parent for them to get picked up. If it's a staff member, make sure that they can safely leave the building, or if not, can coordinate a way for them to get home from the isolation area as well. The biggest question we're getting around this is who else has to self-isolate in this situation? And what that really is going to depend in large part on is, have you truly been able to keep people 6 feet apart with a mask on at all times? Because the way the CDC and IDPH define close contact is within 6 feet of somebody for more than 15 minutes, whether or not you're wearing a mask. So that means that if you are able to keep people 6 feet apart wearing a mask at all times, and you have seating charts and you're able to tell where people are, that only that person who has symptoms or tested positive likely has to self-isolate, not everybody who's been in contact with them. If you can't do that, then it's everybody within 6 feet of that person, which is why the seating chart is so critical in every place you have in the school building.
Thank you, Shelli. And we're also getting quite a few questions about the FFCRA, what leave employees are entitled to, and accommodations. Nicki, can you give us some of the basics on the FFCRA?
Yeah, absolutely, Aris. And a lot of you all experienced this in the spring with leave
and are starting to see the requests and the questions come in again. And so we're happy to revisit this with you all. I did want to note that we have issued a leave and accommodation guidebook. For those who are interested, please let us know. We're happy to talk with you about that guidebook. It has forms, but it also really lays out all of the FFCRA leave that employees may be entitled to. But just to sort of touch on the basics, and as a reminder to a lot of you out there, there's sort of two sets of leave that you're entitled to under the FFCRA. The first is what we call emergency sick leave, or ESL. All employees are eligible for ESL if they meet one of the 6 criteria laid out under the FFCRA. I'd encourage you guys to go ahead and look at the Department of Labor FAQ, or call us if you want to go through all of those. But essentially, if you are quarantined on orders from a doctor or local county health official, if you're caring for someone who has been, or if your child is home because of a daycare or school closure, those are sort of the big reasons. But again, there are six reasons. If your employees fall into one of those reasons, they are likely eligible for ESL, which is the emergency sick leave. It's up to 80 hours for full-time employees. We get a lot of questions. This is a one-time allotment. So it's not for every occurrence that someone is quarantined. It's just they get 80 hours total. It's less for part-time staff. And then there is the expanded FMLA or EFMLA, and that is for folks who have been employed with you for at least 30 calendar days. And it's for those who need to take leave to care for a child whose childcare or school has been closed because of COVID. The EFMLA, the emergency FMLA, differs from regular FMLA insofar as that after the first 2 weeks, it is paid at 2/3 of the rate of pay, and that pay is capped under the statute. This is not an expansion overall of the 12 weeks of FMLA that you need to keep in mind. An employee is entitled to 12 weeks total of FMLA, whether they're taking regular FMLA or they're taking this emergent or extended FMLA for childcare or school closure needs. The difference with this extended is that you do get that 2/3 pay for after the first 2 weeks. So typically what you'll see is, for example, an employee who says, my child's school is closed, I need to take leave. They'll take the paid emergency sick leave for the first 2 weeks. You'll start to run the emergency FMLA as well, and then they'll continue on with those 2/3 pay for the FMLA for the full 12 weeks. One thing, a question that has come in a lot is whether if your child's school is on or you have a teacher whose child's school is on a hybrid schedule, when they are closed, is that when the kid is home learning remotely, is that considered a closure for FFCRA purposes? And the answer to that is yes. So again, this leave right now is in effect until December 30th. We haven't seen anything yet from the federal government about expanding this or extending this. So that's the leave. And then after that leave is exhausted, depending on what the issue is, they may be eligible for sick leave under your regular sick leave policies. They may be eligible for FMLA. They may be eligible for other accommodation or other leave, depending on what's in your collective bargaining agreements and what they're experiencing. So that is sort of the basics of the FFCRA, and we know that there's sort of a number of questions that flow from that. And again,
Nicki, let me ask this one because this has come in. What if a teacher has underlying conditions and doesn't feel comfortable being in person as a teacher, but the district is going with in-person instruction? And we're also getting a lot of questions related about teachers who just don't feel comfortable coming in to teach.
Yeah, we're seeing a lot of those questions. So the first is, if someone has an underlying condition, it's possible that they're eligible for this leave. It's dependent on the circumstance. If they have an underlying condition and their doctor has ordered them to isolate or quarantine, then they may indeed be eligible for this leave. If they just have an underlying condition, but they don't have that type of quarantine order, then no, they would not be eligible for the FFCRA. Then you need to look further to decide whether there's some sort of accommodation that you can provide or need to provide in that circumstance. And that, again, is the typical ADA interactive accommodation conversation. If someone just doesn't feel comfortable coming in, that is not something for which, I mean, the FFCRA is not available to them, and they're not eligible necessarily for some sort of accommodation or other leave. I know some districts have under their CBAs unpaid leaves of absence that are discretionary, and that's something that your district may need to look at and decide. But ultimately, if it's simply discomfort, a teacher does need to come in if your school is teaching and is in person. You know, and is either hybrid or fully in person, and they need to be in the school building.
And Shelli, also related, what's happening on the union front and how are districts responding to these issues, the FFCRA issues?
Well, I mean, I think that, as Nicki has mentioned, a lot of districts are trying to work with their unions as to how to best accommodate staff who either have underlying conditions or who are otherwise uncomfortable with coming back to school, whether it's because of their own health or someone they live with. And, you know, as Nicki mentioned, there are caps under the FFCRA related to how much money you get, even if you're on the expanded FMLA. So that's $200 a day. And many of our teachers per diem is higher than that. So for instance, many districts are working with their unions as to whether or not that person would be entitled to take an additional portion of their own sick leave, for instance, to get them up to a full per diem amount per day. I did want to mention two other things before we move off of this topic, though. One is that, and I think a question just came in on this also, is that with respect to the expanded FMLA leave, with those teachers who have kids at home who might be on an opposite schedule of theirs, for instance, it is the employer's decision to whether or not to allow that intermittently. So to allow that teacher, for instance, to perhaps take a day here and a day there when their kids are home. So that's different than the regular FMLA where we have to allow intermittent leave. So that's one piece of it. And another really interesting question that we got last week actually is what happens if you've got two teachers who work in the district? Are they both entitled to this 12-week period? And when we looked into it under the current guidance, it does not appear that this would be a situation that they would actually be forced to split the time. Now that might change, but at least for right now, it appears that each teacher might be able to independently take this 12 weeks of leave for this purpose, keeping in mind, of course, that it currently expires December 31st. So it would really depend on when that leave started, if they would actually be able to take that time, but we'd have to just wait to see what happens with that.
Great, thank you.
And one thing I just want to add, and I think that folks know this, but it's important to remember, which is that if there's a circumstance where your teacher can telework, so you have both a remote option and an in-person option, or you have classes that are in and out. If they're able to telework, then obviously they can work and they are not eligible for FFCRA, and you pay them their normal salary. What we're talking about is circumstances where someone is out and cannot telework, either because you don't have an ability for them to teach remotely, or in fact they are sick, or they're caring for someone who's sick and simply cannot perform telework during that time.
So Jen, we got this question in a couple permutations. Is it best practice to keep parents out of the school building to limit exposure?
In short, yes. There are some legal obligations where you need to meet with parents. I think all of those can be satisfied with remote meetings. And there's also some circumstances where parents technically have a right to observe classrooms or have their experts observe classrooms. But even that school code provision talks about accommodating safety. So right now, I think it's fine to just say it's simply not safe to do those in-person observations. I would suggest offering an alternative, not necessarily a remote observation, but an interview with, say, school personnel to get some of the information, say if it's for a private evaluation or parent assessing placement options. Try to think of some mode of communication where you can get the parent some information, but I think you are in solid ground in saying no, for now on safety reasons, you cannot physically observe.
And Ares, just to follow up on that, I think that school districts should probably revisit their visitor policies generally and really look at those and have some temporary measures in place to have, first of all, face covering requirements and make sure that those are publicized. I know that a lot of people are open right now in the summer for construction work, and they've already implemented those rules, but really looking at the visitor policy and making sure it complies with the new safety measures.
Right, and
yeah,
Dana,
and this is maybe a place to bring up our proposed resolution and process for reopening plan. because if you include something in your reopening plan about limiting visitors, that's one of the reasons we are suggesting a resolution, because then your reopening plan trumps your board policy. Now, if you haven't done that, then you need to work, like Dana said, then you need to be looking at your board policy, but it would be another reason why you might put it in your reopening plan and have the board approval, so that you don't have to worry about a policy that probably does otherwise afford visitors, you know, access to your building.
Right. You know, there's also some questions before we move on, just on the leave issues, and I just want to make sure that we get to those. So, and you know, Shelli and Nicki, will put you on the spot again. So if an employee takes FMLA leave in January for a baby, can they then take, could they take it before, you know, if they're planning, I guess, leave in January for a baby, can they take FMLA in the fall, just under the FFCRA?
Right. So as I had mentioned before, this is the FMLA time period, the 12 weeks total, has not been expanded. Just the reasons for which you could take FMLA have been expanded. And so depending on whether you're on what kind of FMLA time period your board policy dictates, so if you're on a rolling or if you have a 1 year, the teacher is entitled to 12 weeks total of FMLA, whether they take that, you know, traditional FMLA because they're after the baby is born, or whether they're taking EFMLA because they're caring for a child who's home because a daycare or school is closed. So it is key to explain. We're getting this question a lot, and understandably with staff that are pregnant or about to give birth, pregnant and about to give birth simultaneously, that they're trying to figure out how to extend that, and the 12 weeks is the 12 weeks total.
Right. And I think and also this is a situation where you want to look at your collective bargaining agreement, because some collective bargaining agreements do provide leave, you know, a child rearing leave or something that might be accessed by teachers. But for those that don't have it, it is the 12-week limit, and you're going to have to deal with that on a case-by-case basis.
If I can just add one piece to that also, a lot of the questions we're getting also on this topic is, if you have something in your collective bargaining agreement that allows for a teacher, for instance, to take a leave of absence, and those teachers are requesting those because your district is one that's going back to in-person instruction, what happens if, you know, something happens and you have to actually go to remote, or if the state says that we have to go back to remote? What happens to those teachers who put in for leave who might now want to come back? And I think that's something that's important to address with your unions, because your contracts might very well say it's for the year, and you have to look at whether you've ever made exceptions to that before. But if you're going to be hiring other people to fill those spots who are willing to do in-person instruction, you may very well not be able to let those people to come back. So making sure you're thinking about that as you address those issues.
So Shelli, here's kind of a related question then. The sort of can't versus won't question. What option do I have for a staff member who can't or won't return to in-person instruction and who also cannot work remotely?
Well, I think Dana started to touch on that question. You have to look at your collective bargaining agreement, your leave policies, as to whether or not there is another available opportunity for that person to be off. And I think you really have to look at digging into, is it a can't or is it a won't? You know, if they just won't come in and they aren't otherwise eligible for leave, it might be a situation where they need to resign if there's not something else available, versus the can't, that we have to work through a little bit differently as to see if there's other leave available for them, and whether or not we have to accommodate under the ADA and things like that. Dana, I don't know if you have any thoughts on that.
I mean, I do. I think this is a question that sort of highlights the misperception sometimes that teachers have. Of course, if you can't come in, you know, there are always a myriad of things in the collective bargaining agreement that allow for that, because I think union leadership is very cognizant of what the laws are and what the needs are. But there is no, I'm sort of puzzled by the fact that they think you can't make me come in if I don't want to. I mean, and we're not making you, but if you want to make money, you have to go to work. I mean, that's just sort of a basic premise. I think high school students working at Starbucks understand that. And I don't mean to be snide, but I'm sort of puzzled by, you know, yes, there are exceptions to everything, and we want to be good employers and be cognizant of those exceptions and honor them. But at the same time, if you need to go to work, you need to go to work, you know.
And I wanted to sort of make a corollary point, which I think we've sort of touched on, but I do want to address directly because I'm getting this question a lot, which is if a teacher, if you are fully in person or all of your teachers are expected to be in person, is it an appropriate accommodation to when a teacher says, well, I want to, as an accommodation because of my health condition, I want to work remotely. If you do not have any remote teaching positions, you do not have to create one in order to accommodate a teacher. That is an undue burden and is not something that you would have to do. So if you have a teacher who has an underlying medical condition or some other issue and they have documentation and you are going to grant them an accommodation, the accommodation would have to be reasonable. So it's something in the classroom. Maybe they need a bigger classroom so there's more social distancing. Maybe they want a plexiglass shield, those kinds of things. But if they are insistent that they cannot come in and they have to stay at home, then we're talking about benefit leave, or we're talking about eligibility for benefit leave. We're not talking about creating positions. Obviously, some districts are having remote positions or remote teaching, and so that may be a way to accommodate teachers, but you don't have to create those positions just to accommodate.
So Nicki, here's another one for you then. Can a school live stream a class that has students present if the remote student and the in-person students sign a waiver to allow it?
Yes, so as we turn from both in-person to remote and back again, these questions are we're sort of back into some of the questions that we saw from the spring about remote teaching. So I don't necessarily think that you need a waiver if you're going to live stream a classroom so you have kids in the classroom and a teacher, and then you have kids at home who are observing remotely. I don't necessarily think that you need a waiver for that. Obviously, those kids would be experiencing what's going on in the classroom if they were physically present. I do think it's a great idea, though, to give your parents notice that this is what's going to happen. And obviously make sure, I'm like the data privacy crazy person on the panel always, but make sure that if whatever method by which you're doing this, that it's secure, that folks can only log in through password protected platforms, and that you are secure in the companies that you're using for this service. A corollary question that we're also starting to see again is, what about videotaping a classroom session live and then allowing allowing students in the classroom to view it? Can we do it? Is it a student record? What do we need to do with it? I think the answer is yes, you can do it. I don't think it necessarily is a student record. What the Department of Ed has said about this is it reminds us that in order to be an education record, it has to be directly related to a student and maintained by the district. And what they seem to have suggested early on, and we haven't seen any updated guidance, is that if you are videotaping a classroom session, keeping it for a very short period of time so any student who's missed it or is learning remotely can view it, and then you're discarding that it's not being maintained by a school district as a student record, and then you can go ahead and discard it. And I think that holds. Most of these videos also aren't going to be directly related to a student. Students are going to appear in them sort of peripherally, but it's not going to be sort of just about a student. You may have some circumstances like that, but I think overall, what you can do this, I would again make sure that you're securing those videos, that they're privacy protected, password protected. Only students who are in the class will get the information on how to access those videos, and then the videos are removed and discarded in a very short period after they're viewed.
Great. So let's get out our crystal balls here. Maybe Jen or Nicki, if a student is denied access to a school because they won't wear a mask, and a student or parent sues because they're alleging that their student is being denied their right to FAPE, how do you think a court will rule?
Well, I guess the place I would start is why they won't wear a mask, and whether we processed that through, the way, in this case, it talks about FAPE. So either they have a 504 or an IEP, whether they brought information from a medical provider, or they filled out your accommodation request form and provided that robust information about why medically, supposedly, they cannot wear a mask. If we get that kind of form, and then the team looks at other options. So they look at, can the need be met through increased social distancing? Does our physical space allow enough distancing that not wearing a mask can be accommodated? Or other physical barriers like plexiglass, or, is there anything else we can do that would still accommodate and let the student? If not, and it's simply not safe for the student to attend without a mask, then it's a placement change, and placement change process would kick into place. So I think you have, I would sort of love to see a test case and how it comes out. I think we have a strong argument that if we've exhausted the process, determined there's no safe way without the mask, considering the other factors that are going on, that the placement change is appropriate, and I think we have a good chance with that case.
Terrific. So Dana, do we need to write a 504 plan for everyone that brings a doctor's note that says, quote, no mask and isn't special ed?
So, I don't want to start a rush of 504 plans, but I do want to emphasize here that, and building on what Jen was saying, there are going to be very few kids that can't wear masks. Very few. So having asthma is likely not going to be an excuse to not wear a mask. Whereas if you have someone who can't swallow, that needs assisted eating, that needs to be suctioning, obviously that student is not going to be able to wear a mask, and we're going to have to figure out an alternate means. I also think that for some kids, even for 504 kids and for kids that are just asking for a mask exemption, you're looking at more what the accommodation is. 504 does have a placement, provision in it, but I think that one of the options should always be, if you have a remote platform, should always be remote is an option. And if the parent accepts that as an accommodation, you're going to have that kid go to remote learning. Do you need a 504 plan? I guess that depends. It depends on, is it a major life function, or is it just something related to this mask, or is it just a preference? I do think districts are addressing this in a good way. I think that is the benefit if you can have a remote program, to just say people that don't like masks, just go into that program. And then you absolve yourself of some of the back and forth and the forms and the testing and whatever, if you just sort of separate people like that. But I understand that's not available to all districts. You might just have an in-person. And then I think you do have to put it through a 504 lens and write some sort of plan that is under 504 in those circumstances.
We also got a question in the Q&A about, can you use CPI with a student that has a mask on? I think that's another variation of this issue of, okay, so CPI, let's say a student has a need of de-escalation techniques that bring you within 6 feet. This is how I'm interpreting the question. I'm not sure. Hopefully I have it right. Can you do that if the student has a mask on? I think, again, we're going to look at the big picture. What protective PPE can be provided to the staff member? What is the student wearing? What's the length of time that you would have to breach that 6 foot? And is that going to be not safe? Or is it? With just the de-escalation techniques, I think that probably you could. Now, when you get into some of the restraints and holds, I think that the PPE is probably not going to be effective. It's going to get torn off. We've had students grabbing hair, they're going to grab the mask. So maybe that becomes a need that we're not going to be able to, we're going to have to change that student's placement because the PPE is not effective considering the need. So that's why I say it's not just a one answer. You're going to have to look at the constellation of needs. What are the reasons we have to get within 6 feet? What are the students' behaviors to make kind of an individual decision about these things?
And I also think from the student perspective, sort of the other way to look at that question is it safe to do CPI for the student if he or she is wearing a mask? And I think that's an inquiry for the for the nurse, for the people that are trained in CPI. And, I don't know the answer to that. I think you'd have to answer it for each student individually as part of the IEP team and indicate as to whether or not that intervention is available for use under these circumstances. Because certainly being restrained, even if it's a proper technique, causes probably stress levels to rise and might affect bodily functions. And I think we need to address that and cover that before we're back in school through some sort of communication with parents and the experts on the team that know about CPI and the nurse.
Thank you, Dana. So those are sort of mask and PPE questions relating to students. Shelli, what about employees who will not or wear PPE or violate the PPE guidelines? Can we use progressive disciplinary steps or measures for those folks?
Yeah, so I mean, tracking in what Dana and Jen were talking about, we also anticipate there will be very few staff members who actually can't wear a mask. We have developed a mask accommodation form that requires the either student or staff member to actually have medical documentation supporting really why they can't wear a mask. So, I know that there may be people listening who don't think masks are necessary. Certainly, I think there's going to be people in communities across the state who don't agree with that, and there'll be teachers and students alike. ISB has been very clear about what this requirement is, however. So unless you have one of the medical exemptions, you have to be wearing a mask. So if a teacher does not have that medical exemption, and how we deal with them is a whole different question, Ares, but let's assume they don't have it and they're just choosing not to wear a mask, you definitely can discipline them for doing that. So that's a violation of any other work rule that you'd have. This is another area where we want to be really clear with the union about what the expectations are, so we don't later have to also be arguing with the union about this. And given how concerned the unions are about safety, and we're hearing that kind of across the state, my hope is that they would also be supportive that, at least a large percentage of people think that wearing a mask is going to help keep people safe, so that teachers alike should be wearing them as well, and disciplined if they're not wearing them.
Great, and we did get a related question. Can tort funds be used for risk prevention items such as cleaning staff and supplies, equipment, PPE, that sort of thing? I'll give that one a shot, and I would say the answer is yes. There's authority for the tort levy found in two places. It's within the school code, Article 17 on finance, and then also the Tort Immunity Act provides authority to levy. In both instances, these are unlimited levies outside the tax cap. And the essential language within the school code is the levy is available for a school district to protect itself and its employees from liability, damages, and loss. And I think you would be within your rights to spend money out of the tort fund on things like PPE, on keeping your building clean, on these days that you might be not having students in the building for mass cleaning. Those would be legitimate bases to draw from the tort fund for expenditures on equipment and a portion of salary for your custodial staff doing this work. So it is important with the tort fund to have a risk management plan. And I'm sure most of you have these risk management plans. There's been years of litigation going back 20 years when districts did not have them. But my reading of the school code and the Tort Immunity Act is spending on this kind of risk mitigation would be permissible. And then the next question sort of is changing gears again, Shelli. Are there any updates pertaining to teacher evaluations during a remote or a hybrid instructional model?
There aren't any updates right now in terms of a difference from where we were at before that I think we all know that put into law that if you failed to evaluate a teacher that you needed, a tenured teacher that you needed to evaluate, then they didn't necessarily have to default to proficient. They could in some circumstances default to excellent if that was their last evaluation rating. I'm assuming, and I think that one of our questions referenced a rumor out there that we should expect something to be out there moving forward with respect to extending this into the 2021 school year. I think we're likely to see that. I do think, however, regardless of what model you're in, we should be expecting a different level of instruction in the fall than we had during, I'm going to call crisis learning in March. Therefore, you should be evaluating, especially your probationary teachers. It might look a little different. You might have to get together with your union or whoever was on your joint committee to talk about what that's going to look like if it's going to have to be different, but they still should be evaluated. I have a hard time seeing that we're going to get any legislation that's going to say you don't have to evaluate anymore. I think it's going to focus more on what happens to things like remediation plans moving forward, teacher dismissals moving forward that all result from evaluation, and maybe the default rating as well. But I don't think we're going to get anything that says you don't have to evaluate teachers anymore. But that's another thing that we're waiting for from ISB to come out with.
Great. So here's another question we've gotten from several people. What are the implications of the Cook County and outside of Cook County assessing officials making COVID-19 adjustments? How is that playing out so far, and what are we seeing? So what we're seeing, in 2020, the Cook County assessor is reassessing the south and southwest suburban areas. Not all township reassessment data has been released. I have looked at a couple townships, Alliance Township and Worth Township, and these COVID-19 adjustments are fairly significant downward adjustments, at least for Class 2, which is single family homes, apartments of less than 6 units, and then also condominium buildings. They are in the 10 to 13% below the prior year assessment. And then on industrial, commercial, retail, office, the assessor isn't publishing actual what level of reduction. What he's doing is providing revised cap rates, but those cap rates are going up. So when a cap rate goes up, when it's applied to the net operating income, the value of the property goes down. So that's what we are seeing, and we are likely to see more of in 2020 for the reassessment townships. We're not entirely sure what we're going to see in the north and northwest area in the city because there's not enough data, but I would expect there'll be something similar. And then outside of Cook, the assessing officials I've talked to, a couple township assessors, what they're doing is kind of a couple approaches. One assessor I'm aware of is taking the approach that, hey, everything happened after January 1 of 2020. The assessment lien date is January 1st. We're not going to touch the assessments this year. So that's certainly one position. More common is that some sort of factor is going to be applied to properties. So the stay-at-home shelter-in-place type orders were in effect for about 73 days. That's roughly 20% of the year. I know of one township where there's a lot of commercial and industrial property, and they're applying about a 20% factor in that township. So different elected assessors are going to do different things, but so far, with one exception, I'm not aware of anyone who isn't doing anything to reflect that in their new assessment values. So that's that on the assessment front. For a totally different topic, let's go to IEPs. Here's a question. Should we, or how do we best amend IEPs to meet the various schedules we may find ourselves in? Jennifer or Dana?
Sure, I'll get us started. So first of all, we do think you should be amending going forward, or as you're doing annual reviews, you need to be talking about whatever phase you're in so that the IEP reflects reality. You know, there was different approaches taken in the spring where it was very last minute, and for some districts it wasn't feasible to update all IEPs. If we're talking long-term, we're going into a year, a semester, we need to start updating IEPs, or at least it would reduce liability to have your IEPs reflect as close as possible what actual minutes, services, goals, accommodations you're going to be providing. So we've seen districts plan to do this in a number of ways, whether it's put it in additional notes, how so if you have the core IEP as assuming you're fully back, and then you put in additional notes, what the change would be if it's blended, or what the change would be if you're remote. That's one way to do it. We've seen some systems actually integrate and start to have a component of the IEP be this individual plan for during remote or blended. So that's what we're seeing on this front.
Yeah, I would reiterate what Jennifer said. I had some questions come in over the past few days about just doing a separate standalone plan. And, you know, I sort of have concerns about that because the IEP is the legal document. And maybe we did some separate standalone plans when we were sort of under the gun. But I feel that any separate standalone plan you would do for a remote or blended learning option would have to encompass everything that's in the IEP anyways, because this is not, you know, this is not just from the middle of March till the end of May. This is indefinite amount of time, and I don't want to be a downer, but I think in order to really put ourselves in a good position to defend special ed claims, the plan needs to be connected to the IEP, because that is the document that legally says what we're doing for the student and how we're meeting the student's needs.
Great. We just got
Well, and on that, yeah,
go ahead, Jen.
one more thing on that. So I'm a little bit unclear to the advantage of doing individual standalone plan and not just putting them, and let's say the parent's in agreement with it.
Right.
If you just add that, amendment page, send the parent the amendment paperwork, now you've complied with IDEA. And why not do that? It would be minimal extra work to fill out that form, and kind of a huge legal benefit in that then you can say that you complied with IDEA requirements.
Absolutely.
We got a question just through the chat on what is the feasibility, or are we recommending, or is it advisable or even permissible for a school district doing in-person instruction to direct their families to quarantine for 14 days prior to the commencement of the school year? Any thoughts on that?
I know that colleges are doing that with the students and asking them to quarantine, but I'm not sure, given, that's one college student going to a defined place. But when you talk about families that are living in the community, college students are going to an atmosphere where they don't have to grocery shop. They don't have to go out and get cleaning supply. They're living in that nice world that we'd all like to return to, where things are done for them. And they're in this little bubble, and it's supposed to be fun. And I know it's not going to be as fun as it normally is, but I don't know that really transmits to a K through 12 environment where people are leaving and coming and going every day. So I'm not sure that has much value. And I think that might just be more burdensome to the families than you want to make it weighed against the benefit you'd receive from it.
Great, thank you, Dana. Maybe Shelli or Nicki on this one. Here's a question. If the district is starting the year remote, can we require the teachers to be in school providing the instruction?
Yeah, I mean, I think you certainly can. It's, the expectation, presumably under your collective bargaining agreement, is that the teachers are in person teaching in the classrooms. I know some districts are requiring this for technological reasons, for just uniformity of instructional provision. Obviously it's something that you are going to potentially have to discuss with your union, but there's no reason that you couldn't require teachers to teach in person if children are at home. Obviously there's some practical considerations that come into play. If the expectation is that you're going to have a lot of teachers who are absent because their own children are remote, or seeking leave, there may be circumstances under which you would not want to require that, but there's no outright prohibition to doing that. And obviously you'll have less people in the building, so the safety concerns presumably of your teachers will be decreased. Shelli, I don't know if you had any.
Yeah, no, I think that you've hit on everything. I mean, I think it's certainly something, as you mentioned, worth discussing with the union. I don't think this is an area that has to be formally bargained, though. I think that many unions might approach it that way, but the teachers are expected to be in the school building. And to the extent that you allow them to be out, I think the flip side of it is actually the part that needs to be bargained, is how are you determining who gets to stay home versus who has to be in the classroom?
So Dana, here's a question for you. If a student has behavioral issues, for example, outbursts of spitting, kicking, hitting, biting, or pinching, can we restrict them to an e-learning environment through the behavioral intervention plan?
I know that's working with this population is challenging, and people have a lot of questions and certainly well-grounded fears about how we're going to manage this. I think the general answer is no, you can't restrict them to e-learning just, without just some discussion about what accommodations we can make for a student like that. And I think to the extent that you have on your school team a resource person that's a board certified behavior analyst, I actually love to work with a professional that has some training in that, because I do think that intervention is very effective. And I think we have to go through those interventions that we can do that are less restrictive before we put them on a completely remote plan. Now, parents I think you always have to leave open the discussions, because you might go into this thinking, oh my gosh, we really want to get this kid, it'd be better for him to be remote. And you might be in a situation where the parents come in and say, we really want remote. And then you can work around how you're going to do that. So I think it's important not to go in with assumptions, to brainstorm a little bit about what the possible accommodations might be. There's several different types of masks that fit different ways, that have neck guards, that are comfortable or more comfortable for certain students with certain conditions. So I think you have to go through all that first.
So maybe Nicki or Shelli, here's a question we've got that I think a lot of people are probably thinking about. What kind of liability does a school district face if students or staff members contract COVID-19 and alleges that they caught it at school?
Sure. I'll start.
Oh, go ahead.
Okay, I'll start with the staff, and you want to go to students. So, with staff, obviously, what we are likely to see is a workers' comp claim, and we talked, and we've done some other alerts and webinars on the issue of the new workers' comp presumption. So the presumption that if an employee gets sick at work or gets sick, that they got it at work. Obviously, it's a rebuttable presumption. One of the reasons that we have been stressing, adherence to public health guidance is that in order to rebut the presumption that an employee got it at work, one of the things the district is going to want to be able to show is all of the ways in which they adhered to public health guidance, or if they deviated, what the basis of that deviation was and why it was consistent with safety of both employees and staff. So I think that would be, something to think about in terms of compliance with guidance.
Yeah, I think the other piece of this as it relates to, students and staff members really is what Nicki was saying in terms of making sure you're complying with either, the IDPH guidance or that the boards are adopting the resolution to allow for the reopening plans. And within that is that discretionary authority on policy-making decisions. And that is part of what triggers one of the many provisions of the Tort Immunity Act that would protect a school board if sued by either a student or staff member claiming that they got sick at school. So that's one of the reasons that when we developed the resolution, it's one of the reasons we're recommending that those school districts that certainly have reached out to us that we work with, that their boards adopt it, because we do think it gives an extra layer of protection because this is bound to happen. And we have to make sure that, for those schools who are doing everything that they can do within IDPH guidelines to keep kids safe, that they are properly protected if they get a lawsuit.
Well, here's
I want to throw in here we're hearing that a lot of insurers are saying that these types of claims would not be covered. So it's a different way to manage risk than districts are used to as far as the risk of a lawsuit. And that did inform our recommendation for the resolution, because you can't necessarily rely on, or you want to know whether or not this is something that you can manage through your insurance. I have districts looking into whether there's any insurance out there that will cover these types of claims. But we know a lot that are saying that this is not going to be covered.
Hey Shelli, one of the questions that had come in, I don't know that we got to yet, was just about which guidance should you be following, local county guidance, CDC, IDPH. I don't know if you have any thoughts on that, because I know people are struggling with some of the inconsistencies.
Yeah, I do. I've had the good fortune of spending time with many of your local public health departments and talking through some of the inconsistencies that they have with IDPH. And virtually all of them I've seen are more conservative than what ISB or IDPH puts out. So what I would recommend that you do is make sure that it's really what they mean by guidance as opposed to kind of best practice. And because when we're really looking at, we don't want there to be additional liability because a school district can't comply with the requirement, for instance, that we keep 6 feet apart. ISB says only as much as possible. So you want to really make sure that you've reached out and understand that the health department's not getting the community on the side of this, you have to do this, because that's certainly not what IDPH is saying, and make sure that that's clear. So in terms of, who should you be following? We want to try to have a middle ground that we're satisfying all the different agencies that are directing. I think we mentioned last time, there is not public health jail for our superintendent, so being mindful of that we just need to do the best that we can. One question that did come in on the idea of physical spacing, now that I just referenced it, is, ISB says as 6 feet apart as much as possible. Is there a minimum? Was one of the questions I think I just saw in the Q&A. And the answer to that is they have not set a minimum. The only minimum I've seen that's different than 6 feet is from the American Pediatric Association, where they really say 3 feet. So the idea of if you're trying to space out your classroom, what will it look like? Can the kids be closer than 6 feet? Certainly ISB has said yes. How close they should be really should be, the answer is as far apart as they can be. I certainly don't know if I would put them any closer than 3 feet, but every district's going to have to make that decision based upon the number of students you have, the size of your classrooms, and all of that.
So we've got a number of questions here sort of on the Scylla and Charybdis situation that many school districts will find themselves, and that is daily symptom certification at school and self-certification. Shelli, what are some of the pros and cons of taking temperatures of students yourself or having them self-certify?
Well, I mean, I will say this, and Nicki can jump in. This is the one issue that I think has gotten more superintendents who have great plans stumped than anywhere else, because even in the best of circumstances, if you found a way to do self-certification, for instance, at home, the idea of how you monitor that is virtually impossible when you actually then look at the kids who are coming into the school building. The question also then comes in, if you've got kids who are, if you're doing a temperature check at school, for instance, then you're presumably asking the child, do you have any of these symptoms? And whether or not the minor under 18 should be giving you those answers. We have very few parents who are actually dropping their kids off at school. So that's a downside to that. I do know that many teachers' unions are feeling more comfortable with the idea of doing temperature checks in the building. But again, I think there are issues with both. Nicki, I don't know if you have any other kind of thoughts on that. It's the area that I think is causing the most consternation.
Yeah, I mean, if, you know, we will, if ISB is listening to our webinars at all, please, you know, we have sought and are awaiting more guidance on this self-certification, on symptom checking in school. This is, as Shelli said, the area we're getting. I mean, if you start to think through the mechanics of this, it gets very complicated very quickly. Obviously, there's some other questions that are underlined that we had come in. For example, what happens what does a district do if a student shows up with symptoms and the parent can't be reached? So they show up, you either do the symptom check there, you see that they're suffering from symptoms. So that's why, again, you want to have that quarantine room, make sure that it is adequately staffed, that the staff have appropriate protective gear, that it's separated from other students, and you have to keep the student there until the parent can come pick the student up. I think the more difficult question, I'm going to kick this one to Jen, is what happens if you have a student who shows up at a bus stop who either hasn't been screened or shows up with a temperature? What do you do then?
So I can only say for sure what not to do, which is we should not leave especially young children alone with temperatures at the side of the road because they had a fever. But from there, your options, so what do you do is, you don't have great options. If it's, you can obviously try to reach the parent. All of this, you're sitting there with a busload of kids who's getting later and later, but, I think the fastest resolution is if you got the parent to come back and get the kid. You can call if the school's able to offer any support and send any supervisor out to manage the situation, and the bus continues on. You wait for the administrator and then the bus continues on. An option, in these community type situations is always to call the police. I'm not sure how that's a real great option, and not sure how happy parents are going to be that you left my kid with the police, but in bad situations, sometimes we use that. Or the last option, I think, is try to isolate the student on the bus, and maybe if the bus was very empty and, the specifics of that situation are going to determine if that's even remotely possible or not. So again, don't leave the kid alone, but we don't have really great solutions on this one.
But I do think that, like all of these questions that are so hard to answer, your best defense is just to be prepared. Someone's got to be on call when you're getting kids to school. I mean, honestly, I'm just going to be truthful with you. I know that you guys are staffed leanly and you're staffed lean, but you need somebody on call when kids are coming to school anyways, because in my experience, every once in a while, the bus will get into a fender bender. Someone will be stopped. You need someone to be able to, in the moment, go handle those things. And so I think planning ahead for that is probably your best defense to, meeting that situation in a good way.
So under the Open Meetings Act, we've seen a lot of changes in the last few months with respect to how meetings are held, how public comment is accepted and provided. Shelli, Nicki, do you want to give us an update on remote meetings, where things stand with the governor's order, when that expires, what we think is going to happen?
Sure, I can grab that one. So the governor's order expires July 26th, I believe, and that allows the remote meetings to continue to take place. Obviously, you do have and there's some statutory requirements if those orders are in effect. Obviously, you can also hold your meeting now in person if you can adhere to, the 50 people limitation and the social distancing guidance. In terms of going forward, we would anticipate that the governor would extend that order allowing remote meetings. We've seen nothing come through yet, although we still are a few days away. But, my expectation at least is that we'll see an extension of that order like we have in the past.
So we got a question on the Consumer Price Index, what I'll call the other CPI, and what are we seeing for the year? What are we expecting? So just looking at the Bureau of Labor Statistics data, in January, February, the number was 2.3, 2.5. It fell to 0.1 in March, and it was at 0.6 in May. So it's been all over the place. I know earlier on during this crisis, there was concern among school business officials that we could potentially end the year in a deflationary position with a negative CPI. And what would that mean for your PTEL limiting rate calculation? I've said this before, but the language of the limiting rate talks about the lesser of 5% or the percentage increase in the CPI. There's no talk of a decrease. So I think there'd be one of two situations there. It would either be zero, or if it were to be interpreted as a negative number, I think there'd be a very strong movement for the General Assembly to come in and just modify that language, because certainly school district costs will not have gone down, and even if we end up with that negative CPI. So that's how I see that potentially playing out. Shelli, any update on ISB guidance regarding partitioning off large areas to allow for more than 50 kids in a cafeteria, gym, or field house?
Yes, actually, this is one of the many questions that Nicki referenced that we posed to ISB. Seems like forever ago now, related to the FAQ and guidance they put out. And although we haven't formally seen anything from them, we do know that informally they've told a number of us as well as others that this is now going to be permissible with respect to very large areas. If you can partition them off to have no more than 50 kids in each area, and then if those areas, the kids can still be 30 feet apart, like you would have it outside. And they do talk about having some sort of screen or something else that does not allow then for kind of transmission between groups, and the groups obviously not mixing together, that they think there is some recognition that, especially in our large high school districts, for instance, the cafeterias and the field houses, this is just a waste of very valuable space if we can't have more than 50 kids in there, if we can keep them safe. So we do understand that that is a change that they've made, and that we're hopeful to get something more formal from them if they update their guidance at some point. I know we we only have a minute or two left. We've got a lot of questions in the Q&A, so I don't know if we want to try to grab one of those. I'll take the first one here. Yeah. Is that if there's any provision that a student shows symptoms of COVID, but they don't feel they need to get tested or won't get tested, if a student is showing symptoms of COVID, the school should send them home so they quarantine for the requisite time period. This is not a matter of a parent saying, I don't want my kid to get tested, or I don't want my kid to come home. If they are showing symptoms, unless they can show you from a doctor, for instance, that it's otherwise related to irritable bowel syndrome, sinus infection, whatever it is, that student should not be permitted back in the building. And the same is true for staff members who are showing those symptoms as well. And that's just to keep everybody as safe as possible.
So we do have a few questions that we have not gotten to, and I think we'll save those for next week with any additional questions that come in and developments that occur. So with that, I would say that was a very fast 60-minute hour. We are out of time for today. We all want to thank you for joining us this afternoon. We greatly appreciate your time and questions. We hope you found today's program helpful. The next webinar in our series will be one next week, next Thursday at noon. That'd be July 30th. We'll discuss these additional questions, any changes in this unfolding environment. You will receive an email today with the link to the webinar recording as well as a link to register for the upcoming webinar. Please feel free to share the recording with your colleagues. Thank you for joining us and have a great afternoon.
Thanks, everyone.
Bye.